Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the neuroanatomy of the accessory nerve. It is also called 11th cranial nerve. The 11th cranial nerve has spinal and cranial roots. The cranial root, that is the spatial visceral efferent, is formed by the axons of the nucleus ambiguus. Nucleus ambiguus also contribute in the 9th, 10th cranial nerve in addition to that of the 11th cranial nerve. The nucleus receives corticonuclear fiber from both cerebral hemisphere. Nucleus means that of the cranial root nucleus. Here, from the nucleus ambiguus, it receives corticonuclear fiber from both cerebral hemisphere. It emerges from the post-olivary sulcus. So this is the olive here. This is just lateral to that. We'll get the post-olivary sulcus. So this is the accessory nerve. Here is the olive, and it is coming out just from the post-olivary sulcus, and that is below the vagus nerve. This is the vagus nerve. Okay, so pyramid, olive, and post-olivary sulcus, from where we are getting the cranial root of the accessory nerve. The cranial root joins and separates with the spinal root in the jugular foramen. It joins, then it splits, it separates out from the spinal root in the jugular foramen. So if you look at the cranial root of the accessory nerve, okay, we'll go there. Here we are seeing cranial root of the accessory nerve exits the skull through the jugular foramen. Jugular foramen also is the passage for other cranial nerve, not like that of the vagus nerve, the glossopharyngeal nerve, also the internal jugular vein. Okay, the accessory nerve joins the vagus nerve in the jugular foramen. It is distributed in the pharyngeal and recurrent laryngeal branches of the vagus nerve to the muscles of the soft palate, pharynx, larynx. So it is accessory to the vagus nerve. It will be distributed through the pharyngeal and recurrent laryngeal branches of the vagus nerve to the soft palate, pharynx, and larynx. So this is the motor nucleus of the cranial root of the accessory nerve. It is bilateral cortical connection. Okay, so it is bilateral connection to one cerebral hemisphere and the cerebral hemisphere, and this is the cranial root of the accessory nerve. It will be in contact with that of the spinal root of the accessory nerve. So cranial root, spinal root are in contact in the jugular foramen, then they split again. The jugular foramen, the cranial root of the accessory nerve, also come in contact with that of the vagus nerve, and it will be distributed along the branches of the vagus nerve to the soft palate, pharynx, and larynx. So we have the cranial root of the accessory nerve motor nucleus. We have also another nucleus, that is the spinal nucleus of the spinal root, that is present in the anterior gray column, that is present in the anterior gray column of the spinal cord in the upper cervical region, cervical 1 to cervical 5 region. Okay, that is also bilateral and unilateral connection from the cerebral cortex. Okay, some fibers are crossed, some fibers are uncrossed. So both the cranial root of accessory nerve and the spinal root of the accessory nerve, they are connected to the cerebral cortex unilaterally and bilaterally. Okay, so this is the part Here is the post-olivary sulcus. This is the olive part. This is the pyramid. Olive is olive shape because of the presence of inferior olivary nucleus. Pyramid is pyramid shape. It is containing pyramidal fibers. Okay. Then spinal root of the accessory nerve formed from the axons of the spinal nucleus located in the ventral gray column in the upper 5 segment of the spinal cord. Okay, so here is the spinal root. Here is the spinal root of the accessory nerve from C1, C2, C3, C4 from the anterior gray column axon, and they come out between the ventral root and the dorsal root of the cervical spinal nerves. The spinal nucleus is thought to receive corticospinal fiber from both the both sides of the brain from both cerebral hemispheres. The nerve fiber comes out between the ventral and dorsal root of the cervical spinal nerve. It entered the skull through the foramen magnum. So remember that the spinal root of the accessory nerve should enter the cranial cavity through the foramen magnum and unite with the cranial root at the jugular foramen. The jugular foramen, we have also the vagus nerve, okay, as well as the glossopharyngeal nerve, as well as we have the internal jugular vein from the sigmoid sinus. Okay, so we got that the spinal root of the accessory nerve, but the cranial root of the accessory nerve does not go through the foramen magnum because it is in the lower part of the medulla oblongata, not below the foramen magnum. And foramen magnum is a big gap, big opening in the basilar part of the occipital bone. Okay, so we'll go to the spinal root of the accessory nerve. If we go there again from C1, C2, C3, C5, from the spinal nucleus accessory nerve that is present in the anterior gray column of the spinal cord C1 to C5. From there, the spinal root will come out between the ventral and dorsal cervical spinal nerve, and it should go through the foramen magnum. This is the foramen magnum, and in the jugular foramen, it is in contact with that of the cranial root. Then it will split again, and it will innervate the neck muscle, the sternocleidomastoid muscle, passes over the posterior triangle of the neck, and it again innervates the trapezius muscle. Okay, so we got that. Now, clinical examination of the spinal root of the accessory nerve. How can we do it? We have two muscles. One is sternocleidomastoid muscle that is innervated by the spinal root of the accessory nerve. Another one is the trapezius muscle that is innervated by the spinal root of the accessory nerve. How can we test the sternocleidomastoid muscle? Turning the head to each side against resistance. Okay, so this person is moving head towards the left side. Okay, so in that condition, what muscle will work? This is the left sternocleidomastoid. His turning head towards the left side. His right sternocleidomastoid muscle will be taut here. This will act. So the head rotates to the other side of the muscle by the action of the muscle. Okay, turning head on each side against resistance. An intact sternocleidomastoid turns the head to the contralateral side. Okay, we have one terminology called Rhineck or torticollis. That may happen due to some type of difficult delivery, but it is also found even in C-section. Exact cause is not known, newborn baby may develop wry neck, and it may be discovered after a few weeks, and there may be fibrosis in the sternocleidomastoid muscle, so that may happen. So it may be associated with paralysis of the sternocleidomastoid muscle in the adult also. Okay, so both are possible. Exact cause sometimes is not known. So testing the strength of sternocleidomastoid muscle by rotating the head against resistance. Here is the resistance. A test of integrity of accessory nerve also include asking the patient to shrug the shoulder. Okay, so shrugging of the shoulder is done by the trapezius muscle. A person with paralysis of the spinal root of the accessory nerve cannot shrug. Okay, so one side will be drooped down. Okay, so that indicates that side accessory nerve is not working. That is the ipsilateral side. Okay, so we may test the sternocleidomastoid muscle and the trapezius muscle. Both of them are innervated by the spinal root of the accessory nerve. Okay, so clinically, examination of the spinal root of the accessory nerve, evaluation of the size, shape, strength of trapezius. We can hold the person's shoulder by two hands and tell the patient to shrug, and we may assess the size, shape, strength of the trapezius, and also we can resist and tell the patient to move the neck against the resistance. Head is moving contralateral to the side of the muscle. Okay, so we can easily assess the sternocleidomastoid muscle and also the trapezius. So trapezius muscle, paralysis posterior view, there will be drooping of the shoulder. Shoulder is drooping down due to the paralysis of the trapezius. This is the trapezius muscle innervated by the spinal root of the accessory nerve. Okay, sternocleidomastoid muscle paralysis, right anterolateral view, that is possible. So this right muscle is paralyzed. Person cannot move the head and neck towards the left side. Okay, and that's all about the neuroanatomy of the accessory nerve or the 11th cranial nerve. If you have any question, please feel free to ask me. Please share the information with your friends. And please support my channel. Please subscribe me. And have a nice day. Bye now.